Roll call, please, Gary.
Brennan.
Here.
Chartrand.
Here.
Dahlhoff.
Here.
Halfway.
Here.
King.
Here.
Colzer.
Here.
Mowerhand. Here. Mosier.
Here.
Fawcett.
Here.
Table.
Here. Everyone, please stand. We'll have an invocation. Lord, we ask for your blessing that there may be peace in our lives. We pray that we will not succumb to worry, fear, or defeat as we proceed with our elections. We pray that all Americans will invite God into the election process, for He is our true Savior, and we can be sure that the outcome is in His hands. We keep in mind that the real battle is not fought against what is seen, but what is unseen. For the real enemy is not a person, but Satan. May our nation turn back to God, for as we state in our pledge, we are one nation under God. Now I ask for a moment of silence to reflect on our own special intentions for those that have recently passed away and those in distress. Amen. Pledge to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Everyone should have received a copy of the September 26th and October 4th meeting minutes. Does anyone have any corrections at this time? If not, I'll announce they stand approved. For the Rules and Legislation Committee for Rule 6, Terry.
The Rules and Legislation Committee is met, and they recommend to waive the rules to act upon late resolutions this evening.
Moved by Brian, second by Larry. All in favor say aye.
Aye.
Opposed? Carried. We now go to privilege of the floor. Does anyone from the public have any comment at this time? Hearing none, we'll proceed to communications. Terry?
The New York State Senator Joseph Griffo acknowledged receipt of the board's resolutions increasing the DA salary and directing the county treasurer to pay according to law, and the resolution urging state budget amendment to requiring the state to reimburse counties for the increased DA salary. The board acknowledges receipt of resolutions adopted by the Delaware County Legislature urging state legislation to fully reimburse counties for the DA salary increases, and urging Governor Cuomo to sign the Public Defense Mandate Relief Act authorizing the Indigent Legal Service Office to adopt, promulgate, amend, or rescind rules and regulations that would require the state to reimburse counties for public defender services. Also, resolutions adopted by the Essex County Legislature supporting the Memorandum of Understanding among public and private organizations regarding recreational access to Adirondack state lands, and by the Washington County Legislature calling on the governor and state legislature to more equitably and efficiently impose the 911 surcharge on all wireless communication devices and use those revenues to finance life-saving county services, and also plan for next generation 911 by creating a department that supports county public safety answering points and enhances local emergency dispatch services. And by the Seneca County Legislature calling upon the governor and state legislature to work with New York County Congressional Delegation to amend and improve the Family First Prevention Services Act of 2016 to ensure essential fiscal resources are maintained to support families in need. And that concludes the correspondence.
Thank you, Terry. And now the reports of the county officers and departments. Terry?
The Lewis County Budget Officer Liz Swearingen has submitted the 2017 tentative county budget. Copies have been distributed to each legislator attendant to her budget message. Legislators have also received copies of the Treasurer's October report, the October 25 solid waste, and October 5 and October 27 highway audit reports. The July 19 meeting minutes of the Health Services Advisory Committee have been received and have been placed on file.
Thank you, Terry. Now we go to reports of standing committees. Bill, Ways and Means, Buildings and Grounds.
Well, first off, I'd like to tell Larry that the meeting that he missed, my report was 4 minutes, Larry. You missed out on that, bad boy.
Okay, so you're saying this one's going to be 2 minutes?
No, 8. Obviously, we talked a lot on budget, and Liz will be addressing that. Speaking of the budget, she budgeted our meeting for 2 hours and 30 minutes, and it lasted 2 hours and 14 minutes. So even our meetings come in under budget, so she's doing great. The county clerk reported that the state has said that we probably will not be able to do tractor-trailer road tests after the first of the year. The state, we tried to do an accommodation with using New Bremen's parking lot, and but the state said they have to have a turning lane, and the turning lane on Main Street here, on State Street, was too far away from New Bremen. So we won't be able to do our road test here. Chairman Taybald is talking to Jefferson County because they're saying that they're not going to do them either, but maybe something can get worked out. If not, New Bremen's too far, but apparently Verona, Rome, and Tupper Lake isn't too far, because that's where people would have to go. The water upgrades are done at the PSB. The electrical upgrade at the records building is done. Obviously, you've no doubt seen the signage at the parking lot entrance. That is as a result of the mishap the attorney had, and that should hopefully not let us have mishaps again out there. We talked some on JCC and had a meeting about it. It's still being worked, and probably Liz will be saying more about that. We think we might have a Thanksgiving surprise, a positive one, but it's too soon to tell for sure. Thanks to Chairman Tayball and legislators King and Chartrand, who got the PSC involved in our solar project. We've had 2 telecons. We had one last week and one prior to our meeting today. The original submission by National Grid to upgrade the facilities to accommodate our solar system was $729,000, of which 633 was going to be our cost. Well, the Public Service Commission got involved at the urging of Chairman Taybalt and Legislator Chartrand and King, and our telecon today, now they feel like they can do that for a maximum cost of $250,000, and probably it could potentially be down to $200,000, because they think that maybe they don't need all the equipment that they had originally planned for. And actually, of the $250,000, Green Skies had already budgeted in their cost $87,000. So we're looking probably at a maximum of $163 versus what we had committed to of up to $500,000. We'll have another submission of their cert, and I'm not quite sure that's the right terminology for it, but whatever, we're going to have it next week, and it will firm up some of these costs. And also, we should thank Joan for her spearheading this and making this happen. So that's really good news. The JCC is as well, and that would be my report.
Phil, does that speed up the timeline?
I thank you for bringing that up. Yes, it speeds up the timeline considerably. They would be ready. We could start construction in the spring, like we wanted to do originally. And we did specifically ask them about working in the winter, and that for what they know they have to do, that's not a problem either. So the timeline originally, with that original cert they gave us, was 11 to 16 months before they could have their stuff done, before we could even start our stuff. So now we're talking 3, 4, 5 months, and we'll be ready to go. Thanks for reminding me of that, Liz.
I think she meant, when she asked about speeding up the timeline, I think she meant your report.
I was wondering when she first said that, actually, but
Anyhow, good report, Phil.
Phil, you do have a couple of motions.
yes, I do, Terry. Thank you.
We've got 2 proposals for an energy audit. Now, this is a total comprehensive energy audit that covers heat, lights, and everything. Obviously, we've done quite a bit with lights so far anyway, but this covers all energy usage. And we got one from SmartWatt and another one from Larson. The SmartWatt one would be the typical where we would upfront the cost and we'd have savings over a period of time. The one from Larson would be grant generated, and the grants are from $50,000 to $250,000. For Larson to do that, they would charge us $2,000 to put that together. The committee is recommending that we do get Larson because of the fact that there would be zero cost up to the grant amounts and not shared at all. Obviously, if we went over the grant amounts, then we'd have a share in it, but the potentials are from 50 to 250,000. So on behalf of the committee, I would make a motion that we engage Larson to do that for us.
Motion by Phil, second by Dick. Discussion? Questions?
One question, Phil.
Sure.
Isn't that also offered by National Grid or something similar?
SmartWatt is National Grid, as it turns out. And it is offered, but this isn't the grant-focused one that SmartWatt offers. And they're always there, too. We've used them quite a bit for the electrical, like we did just the one in the records building. We used them in the highway garage and the transfer station. So we've used SmartWatt quite a bit. But again, this is kind of a different situation because it's totally grantable if we're accepted. But also, it would, the idea is, and it would be with both of them, by the way, that we would have a comprehensive long-term plan of what we should and need to do to upgrade our energy uses.
Thank you.
For better use and lower cost, obviously.
Yeah.
So the part that we felt was important was to have a long-term plan and something we could go for, you know.
Thank you.
Any other comments, questions? All in favor of the motion, say aye.
Aye.
Opposed? Carried.
The other motion, thanks Jerry, is to authorize County Treasurer Patty O'Brien to refill a full-time account clerk due to promotions effective upon the date of retirement of Deputy County Treasurer Cindy Weidrich.
Moved by Phil, second by Craig. Discussion? Questions? All in favor of the motion, say aye.
Aye.
Opposed? Carried. I think you're done, Phil.
No, I'm done, all right, Terry? Okay, thank you.
Okay. The Rocky, Social Service, Office of the Aging, you?
Thank you, Mr. Chairman. Update on Department of Social Services. HEAP opens November 14th for general applications. DSS is not able to distribute applications until that date for regular HEAP. If you have access to the internet, you are encouraged to apply electronically at mybenefits.ny.gov. Paper applications are available the 14th for those that wish to apply by paper. DSS will also be doing a robotic call on November 14th to all early mail-out and auto-pay recipients to notify them there is no need to apply or submit any further information. that their case has already been processed for payment. The DSS has new security procedures in place. All visitors to DSS are now required to be screened by security and wanted to check for weapons. This process is very brief and is for the safety of all visitors and staff. And that completes my report, Mr. Chairman.
Very good, Rocky, thank you. Brian, county officers, veterans, junkyard, HR.
Thank you, Mr. Chairman. Ward was on his bi-monthly meeting with us, so he wasn't around. To give you an idea of what's going on, Junkyard Review Board, we met last month, is going to review their bylaws, and they're going to review the junkyard law to see if possibly there's a way that we can speed up forcing the people to comply with the violations of the junkyard. So they're taking a look at a few things that Ward handed them last month. They're working on that. On the HR end, we have a resolution to approve a consultant called SciTech. If there's any questions about what they're going to do, what's involved and stuff, you can ask me now, or you can ask me when we come up with the resolutions. Derek Davies, he wasn't around. I just want to make a note with Derek. His co-worker, Stephen Kilinowski, his brother-in-law has stage 4 cancer, and apparently he is not doing very well, so his wife and him are executors of the estate and stuff, so he'll be gone for a while. So just wish everyone would keep him and his family in their thoughts and prayers. And that's all that I would have, Mr. Chairman.
Very good, Brian. Jerry, courts and law.
Excuse me, thank you, Mr. Chairman. Radios, E.F. Johnson, upgrades, keeping up with all the technology and stuff, is offered to take radios back and upgrade them. They found a weakness in the radio capacitor. They add to it and do the software while it's down there. What that does is keep us up with the cutting edge technology, so we'll be swapping them out. 35 at a time. We'll start with fire, then end up with police and emergency management. It's an upgrade. If we don't stay up with these upgrades and keep up with the technology, we'll be like we were with our old system. If you don't do these improvements, you can't do the next step in the curves. So they're doing that while they're down there. We also got some extra, excuse me, frequencies. They call them TAC channels. They're low wattage, they're off the air to use on the fire grounds and stuff. And they will put those in free of charge for us. So it's about a $40 savings per radio. So other than that, Sheriff's working on hiring people, making fairly good progress. Some are going for the physicals and stuff like that. Have some resolutions in the packet. I'd be glad to discuss them if anybody's got any questions when we come to them. Thank you, Mr. Chairman.
Thank you, Jerry. Larry, economic development.
Thank you, Mr. Chairman. I had a time, Phil, how much time do I have?
I cut mine short, so you can have extra.
On the business park, BCNA is moving forward with the shovel-ready process. Harrisville property, we continue to struggle with cooperation from the existing property owner, continue to make efforts to engage him regarding use of that property. The next business breakfast will be held on November 15th, and it will be held at the Ridgeview Inn. We have had some good feedback from these events and can point to multiple activities that have resulted from discussions at past events. For example, the Kazine Trail, 4-H training classes for welding, robotics, 2 business CFA applications. Small business funding seminar, we held an event on October 17th to provide information for small businesses with various agencies. 16 individuals attended, and funding organizations involved were the USDA, U.S. Small Business Administration, JCC Small Business Development Center, PTAC, Bank, NCA, and the RIDA, and also Key Bank, or Community Bank, I'm sorry. Manufacturing Day was held. We coordinated with the Jefferson Economic Development, BOCES, and area high schools to promote careers in manufacturing. This was the second year we actually sponsored on-site tours at the local companies. Had good participation in Lewis County with Copenhagen, South Louis, Long Little Beaver River schools, sending students and Viking CITES, on the filter, interface, Grand Slam Safety, and AMF all hosting students. Loan fund application has been received and will be reviewed by the loan committee on October 27th. The Lions Falls Mill, we had a ceremonial event last Friday and actually postponed the tower drop until Monday morning. That's down, and that project is on budget and on time. And that's the end of my report, Mr. Chairman. Hearing any questions?
Any problems getting the tower down? Everything went on hitch? Without a hitch?
Yeah, it's sort of like falling trees. When they started to pull it over with a track hose, it spun and didn't end up exactly where they thought, but didn't hit any wires, didn't hit anybody, and came down inside the fence, so all was good.
Ground shake, there was some concern about within the
No, it really, because it sort of collapsed on itself. It was just a steel tank that was quite old and tired, and it just sort of hit the ground muffled, and that was it.
Okay, good. Thank you, Larry. Craig, we go to you for taxation, elections, IT.
Thank you, Mr. Chairman. Town of New Bremen made a request, a cleanup on an abandoned property to have it added to the county tax bill. We already have a policy in place, but this is going to be reviewed, and they're going to be sent the policy, and it'll be presented next month in next month's board meeting. Bottom line is we intend to oblige them and help them out in this situation with this blighted property. We had a request from Mike Lideker to somehow advocate for the 911 numbers to be properly displayed in every residence in the county. We'd like to reinforce to everyone that this is for their own personal safety. There is specifications out there in the form of a leaflet. We'd like to remind everybody to make the effort to clearly post the 911 numbers on their property, either on their mailbox or on their residence. 4-inch size lettering, block lettering, nothing fancy. And if everyone could do that, it would help all our emergency personnel. It might very well make a difference between good and bad happenings to their own families. So we encourage that. Okay, also taxation sent out a memorandum to all the village clerks, town clerks, and school business managers regarding their policy on exemptions on taxes. They're entering those now, and they'd like a return by November 18th by all these entities so that they can be properly inputted and the due credit is given where it's deserved. For IT, I just learned today that we're very close to doing a fiber connection at the Harrisville Tower. We had some fortunate cooperation from Verizon to use a system that they already have in the ground, so we don't have to take the wire so far to get it from the existing tower to the new one. So we're very hopeful within 2 to 3 weeks we'll have an active tower, to give internet to the residents up in Harrisville area, which I think is wonderful.
There's a lot of enthusiasm for that, I'll tell you, particularly from the Lake Bonaparte people.
Yeah, we're seeing a lot of enthusiasm around the county for this because it is working. This Mohawk
is doing a great job of getting it out there. And from what we're seeing, they're giving internet services fast enough to make most everybody happy. And I thank Adam for that. And that ends my report. Thank you.
Very good, Greg. Greg, transportation, solid waste.
Thank you, Mr. Chairman. Just a few things for solid waste. Everything seems to be going smoothly budget-wise. We had a bid opening for a loader, and the low bid came in from Vantage Equipment at a grand total of $114,175, which I am going to put as a motion that we accept this. Actually, I'll do it now. A motion to award the bid for an amount of $114,175 to Vantage Equipment of Syracuse for the purchase of a 2017 Volvo front-end loader for solid waste department.
Okay, moved by Greg, second by Greg. Discussion on the motion. All in favor say aye.
Aye.
Opposed? Carried.
The zero sort building is coming along well. Pete's happy with it, and he's very pleased with Dank helping out with the cost of that. And I think they've really helped us a lot. They're going to cover up to $600,000 on that building. As far as the trash end of it goes, we've almost got as much recyclables this year in September as we had for the whole year 2015. So it has really done well. The clear bag, I think, really helped out. As far then to the highway department, we're going to have a bid opening at our next meeting for bulk oil, and then we also Stan announced that he will be retiring in March, so Dave's looking for a replacement to refill that position. And the account clerk, Carol Bush, is filling in that position until the human resource meeting this month. We get to look at that. And that's the end of my minutes.
Thank you. Greg? Dick, hospital?
Okay, thank you, Chairman. First off, we talked about a search committee for a CEO at the hospital, and Chairman Mike selected 4 of us to be on it. I'm on it as one. He also formed a committee organizational chart to see what we want the hospital management team to look like in the future as well, and married 2 together. So those 2 committees will be working. He didn't have a due out for it yet, but I would assume it'll take a month or 2 for that work to be done. And the actual search will take, as we all know, 4 to 6 weeks probably to do. Our employee of the month up there this month, well, for August, was Lisa Woodrick, food service helper. And in conjunction with the union and everything, August sounds like a long time back, but they have worked it out, and this is the schedule that everybody's happy with, because it gives them time to put their applications in and then get them read and get somebody selected. So Lisa is a food service helper. She demonstrates great enthusiasm with her job. She always seems to have a smile on her face. She always makes an effort to greet others. She makes a point of being considerate. It always brightens someone's day when they see her in the hall or the kitchen. She is kind and upbeat and is the reflection of the employee that makes Lewis County General Hospital special. When you see Lisa, please congratulate her as the Employee of the Month for August. We've got some positions. I just as soon talk those when we get to them. There's a resolution in there tonight, and I think they'll all be clear and understood, straightforward. And then we had the breast cancer awareness dinner, and I've asked Andrea, who's on the committee with me, to speak to that because she attended it. I was home babysitting grandchildren, so others could attend.
Dick, can I ask you a quick question?
Yes,
is there openings on the board, on the hospital board?
Yes, there is, and on the 15th of November, we'll have a resolution to appoint to fill that one.
You've had applicants? And
we've got applicants, committees met, we've got applicants that we're ready to put forward. And then we've got 2 applicants for next year for reappointments as well. And one has put in an intention to ask to be reappointed, the other one hasn't yet, so that'll be coming along on the 15th. I'm not real favorable fan of late resolutions, so this works out where it can come out for that meeting and everybody can see it and we can discuss at that meeting.
Thanks.
Thank you, Dick, and I guess, Andrea, you can complete Dick's report for him.
Okay, thank you, Mr. Chairman. Yes, I did attend the breast cancer dinner. And once again, it was very, very nice. I'd like to thank Denise Hirsch and her team for putting on such a great dinner, and it was a great fundraiser as well. Joanne Dickup also does a great job. The Fund for Hope helps patients that are battling cancer, and it helps with costs such as hotel and gas that are not covered by insurance. And the money that is raised does stay local. They've been able to donate $79,383 to help 421 cancer patients with their journey through the Lewis County General Hospital Fund for Hope since 2008. This year alone, they have helped 55 applicants in the amount of $9,205. Also, I would like to mention Kathy McIntosh. She is a survivor of cancer. She was a guest speaker, and she told us about her 18-year journey with cancer. It comes and it goes and it's somewhere else. It gives me the chills just to tell you about it. There were tears and smiles as well. And also the entertainment was fantastic. We had a lot of laughs. And I would like to encourage more men to attend. This year I think more men than ever attended, which was really nice to see.
Very good, Andrea.
Thank you.
You're all set there then? Okay, so would you like to go on to public health now, Andrea?
The director updated the committee on the community health assessment and the community health improvement plan. Public Health has partnered with Fort Drum Regional Health Planning Organization and Jefferson and St. Lawrence County's public health departments to complete the health assessment. The Lewis County Health and Human Services Council has served as Lewis County stakeholders group for priority setting. 2 priorities have tentatively been selected: reduction of obesity in adults and reduction of obesity in children. The next strategy setting session will be held in November. Public Health Quality Improvement Committee has completed 3 of 8 meetings and have identified 31% of the programs reviewed to date as evidence-based. Penny feels they will easily meet the 75% goal of evidence-based programming by the time they complete the next 5 meetings. And for the community services, Pat Fralick, Community Services Director, had co-chaired the Regional Planning Consortium kickoff event held October 7th. The group's purpose is to monitor the implementation of Medicare managed care for people with mental health or substance abuse who have Medicaid managed care in the Tri-County area, making sure if problems arise, they are identified properly, responding with appropriate solutions. This was attended by local agencies who serve those populations. Cradle Community Center opened its new opioid treatment program in Watertown, enabling more New Yorkers to be able to participate in the medication-assisted treatment for opiate addiction. The expanded treatment service opening today has the capacity to serve up to 100 individuals with opiate substance use disorder by offering medication, assisted treatment, and counseling services to those in need in Jefferson County and surrounding counties. It is currently treating about 30 clients from Jefferson and Lewis counties. The program's medical director is Dr. Dan Pisanello. Mountain View Services will be partnering with the Edge Hotel to feature the film Chasing the Dragon on Saturday, November 5th at 11 a.m. and 5:30 p.m. The new film focuses on the opiate and prescription abuse epidemic sweeping our country. It is a documentary to help all of us understand better the problem and deeper appreciation about the dangers. Also, I attended the Northern Center for Independent Living Walk in My Shoes Poverty Simulation exercise on October 18th. The exercise helps individuals begin to understand what life is like with a shortage of resources and the stressful conditions that follow. It moves people to think about the harsh realities of poverty and to talk about how communities can address the problem collectively. Thank you, Mr. Chairman.
Very good, Andrea. Go to the county manager report, Liz.
Thank you, Mr. Chairman. Before I talk about the budget, just a couple of items. First, I want to commend the Sheriff's Department. As you know, Terry Clark has been heading up a workers' comp safety committee, and Terry advised me that the Sheriff's Office has gone for 4 quarters without any workman's comp claims. So that's really commendable. JCC, I'll turn to Frank and see if he has any additional updates. We're still waiting on the contract to be signed and signed off by the JCC board. Frank, do you have any updates on that?
That's about what we're waiting for now. We're still in the background working on various curriculum and putting some of those programs in, basically in draft, working with JCC.
Okay. Frank and I were talking recently, and we've obviously been talking to JCC. I've had several members of the county staff and the community approach me about ideas and suggestions for the curriculum. We're going to suggest that after we get the contract signed, we'll probably end up with 2 steering committees. I'm assuming one will be for the building process to supervise that, and then a second one will be for an ongoing curriculum discussion. Ultimately, at the end of the day, the curriculum does belong to JCC, so they would certainly have the lead in that. But I've heard some good ideas from the community and from department heads here that I think we'd certainly like to get into the flow of ideas. Terrence Harris, who many of you have met, who's the head of the arm of JCC that's in charge of this, is in the process of hiring somebody who will be in charge of the outreach program here in Lewis County. So once they get that person hired and on board, I think then we'll have an opportunity to really focus with that particular person on what the opportunities might be. So stand by on that. Let's see, Tyler. Okay, we're in the home stretch here. Believe it or not, after 11 months. So just a couple of key dates for everybody. We're going to stop processing purchase orders and purchase requisitions and writing checks on November 17th. On November 18th, our team will get together. We have some work we have to do to get the files ready. We send them to Tyler. They convert them in. Now, this is all of our account activity. It's all of our budgets and all of our actual activity in our general ledger. We send it up to Tyler. They put it into basically their database. They will send that back to us maybe before Thanksgiving, but more likely on the 28th. At that point, our team sits down at the table and we literally go line by line by line for the entire GL, making sure that the balances we sent them came back in the correct format. At that point, we're ready to turn the system on. We anticipate now that hopefully that will be on the 29th or 30th of November. So just if you have any questions about that, please go ahead and see me. One thing we did not get to cover in the Excellus meeting that we just had before this meeting, if you recall last year when Excellus was in, one of the things they talked about was the Blue for You program, which is a wellness program. And the way it works is we offer our employees, both county and hospital, the opportunity to get a blood draw, which would be done by phlebotomists at Lewis County General Hospital. And confidentially, you go in, you get your blood drawn, and they are searching for chronic disease problems that people may have. The information is sent to you and to your physician only. Last year, I think we had 87 participants in the total program. This year, we're going to use a little bit of money from the self-funded healthcare plan, and for anybody who shows up to do the blood draw, we're going to give them a coupon for a $10 gift certificate for either a gas card or Walmart. We really want to start to get people focused on the wellness side of healthcare, and we think this is a good step. I think Excellus would certainly agree, or they've been encouraging us that a lot of the best programs offer some small incentive to employees to come in and get the blood draw done. Gives you a very good baseline for where you are with cholesterol, with potential for heart disease, diabetes, kind of the major chronic diseases we all know about. So we're going to be doing that. You're going to see some posters. The blood draws will be 3 days in December, but we'll be getting more information out to our employees on that.
Liz, on that item?
Yep.
I suspect it would be for those that do not already have a primary care, just people that have not.
It's actually for everybody, and I think a lot of people, the people who did use it already had a primary care physician. You can just send the results to your primary, number one, and number two, if you do it repetitively year after year, then you start to build a baseline of your profile. But again, it is confidential between the employee and their physician, so there's no issues on that. Okay, so I guess we're ready to talk about the 2017 budget. You have a budget letter in front of you. First of all, I'd like to thank the Lake County legislators, obviously, especially the Ways and Means Committee, and the Lewis County department heads and their teams for all the hard work and thoughtful discussion we've had on the 2017 budget. It's sometimes, I think, maybe Patty and I only see how much work goes into this budget at all levels of the county, from the legislative side and from the department head side. But I got to say, after doing this for a few years now, I'm very, very confident that the department heads and their teams not only fully appreciate the importance of their role as representing their individual disciplines, but they take very seriously their guardianship role of the taxpayers' hard-earned money. I'd also like to personally thank Patty O'Brien, our county treasurer, whose professionalism and absolutely tireless work ethic make this budget a manageable process. But I have to say, this county is very, very lucky to have a woman of her intelligence and her stature, so thank you very much. Right now, as the tentative budget stands, we have a decrease in the tax rate per 1,000 from 7.44 to 7.32, and a decrease in the fund balance from 920,000 to 820. And obviously, legislators, you all have your packets of the detailed budget in front of you. 2 years ago, we set about to kind of define some long-term strategies, I think, that would define the financial goals of the county that would last kind of beyond any 1 year. And we continue to use those. The target was or continue to target a general fund balance of $11 million. That is it is recommended by the State Comptroller's Office that we hold in the general fund balance about 10% of our operating budget. If you combine our county budget with the hospital, it's about $111 million. So We wanted to make sure that we had that $11 million in the kitty. Obviously, we have sustained an A+ credit rating, and we want to keep that. We obviously also want to try to keep our county service levels for all our departments up to par with where they are. Another important goal was to lower the use of fund balance to $500,000 or less by 2021, which is the time when the current windmill money will actually expire. We are, I would say, we're conservative with our spending, and I think that's actually worked quite well in our favor. We continue to fund all of our major projects without increases to the tax levy. We have paid off the $11 million radio project, and as we look forward to our next major investment in the JCC Extension College, that will be paid for with the remaining $4 million in windmill money. In the current 2017 budget, we're not quite there on the tax cap. We still have about a $156,000 gap to close. However, I want to put that in context and tell you that when we assembled the first round of the budget, we were $1.2 million over the tax cap. We've done 3 things over the last 3 months to drive that number down. First of all, we have reviewed every single department line by line and eliminated many of the year-over-year increases. We've eliminated many of the year-over-year increases, simply asking everyone to do more with a little bit less. The other thing we had talked about a couple of times was the risk pool. We had $391,000 of what-if money various departments had put in for, I'll say, contingencies within their own departments. But I think there's a high probability that 100% of those coming true is probably not going to happen. So we removed those $391,000 from the budget, and we have sufficient contingency funds to cover those events should they occur. And I have a list of them, and they will, and I'll just give you an example. The elections department traditionally budgets for an additional election should the governor call one. So we've got that in the contingency fund should an event like that arise. Probably one of the more challenging ones has been healthcare premiums. When we originally put the budget together, we had a 20% increase in healthcare premiums, which would have been a $600,000 increase to our self-funded budget. Obviously a lot to swallow because that didn't include the $260,000 we had in contractual wage increases. After a considerable deliberation with the Ways and Means, with County Treasurer, and with the Chair of the Insurance Committee, the current recommendation, which you'll see in your packet, is to increase healthcare premiums by 10% starting January 1st, 2017, and an increase of 10% every 6 months until the self-funded insurance fund reaches the required $4 million. So it's a big number to swallow. The change from a straight 20% to a 10 and 10 in 2017 equates to about $450,000. We can talk about a little bit more about that when we get to the resolution, if you'd like to touch on that. In the next 3 weeks, Patty and I will dig deeper, and we're going to find the additional monies to get under the tax cap. We've gotten this far. We're not giving up now. But I think the important thing is, this is my 3rd budget with Lewis County, and what's painfully obvious to me is if you step back and look at the bigger picture, last year in 2016 we had about a $700,000 increase for healthcare premiums and wage increases. We're getting some benefit from the state by lower retirement costs as they take over some of the DSS expenses. We'll start to see some benefit, but the bigger picture suggests that we can't keep sustaining a $700,000 to $800,000 increase in healthcare premiums I'm going to run out of places to make up the money in the coming years. It's a difficult problem. It's not anybody's fault. It's just one we have to solve. And the 3 union representatives who you saw over there, sitting over there during the Excellus discussion, we've been working with them. I have to say they've been very good to work with. We have Michelle and Jeff are joining that team. We're having some very substantive discussions. We did pass the 60, the bridge to 65 retirement this year. They are working with us, but we do have to solve this problem. We just can't blindly go down the path of this level of increases on a year-over-year basis. So we'll be having much more discussion about that, but as I said, you'll see the increase in in the resolution packet. So okay, so from revenues, these are some numbers from the highlights of the budget. Revenues year over year are higher by $865,000, but as you also see, expenses grew by $1.16 million. Again, that was there are additional revenues coming in through state and federal aid. Most of the increases in expenses is due to, as I said, the healthcare and wage increases. That leaves a balance to be raised by taxes without the applied fund balance of $16.3 million. As I mentioned earlier, the use of fund balance, we need to stay on a course to lower that to about $500,000 by the year 2021. So we knocked another $100,000 off of that. That would suggest a tax levy of $15.5 million. And on a taxable land value of $2.1 billion, suggests a 7.32 county tax rate per thousand. As we take another, we'll get under the tax cap, that will drop again slightly, but this is pretty much the picture that I think we'll see for the 2017 calendar year. I do want to note that that we did on our sales tax, because that's always a hot topic for us. We did increase sales tax a little slightly under about $200,000. If you recall, over the last 2 years, our actual sales tax revenues have exceeded budget, I believe at about $2.5 million in 2015, and will likely exceed the budget by just about over $1 million in 2016. Recognizing that a quick turn in the economy can make that number go south pretty quickly, but also recognizing that we've been pretty conservative, we felt comfortable making the recommendation to increase the sales tax projection slightly, but not leaving ourselves wide open should something adverse happen. I once again believe that we have a very fiscally responsible budget. I believe that our department heads, as I said, are very aware of both the honor of serving the county and of their responsibility to the county taxpayers to be fiscally responsible. I respectfully submit this budget for public comment and approval, and take any questions. Thank you, Mr. Chairman.
Good job, Liz and Patty.
Thank you, Liz. The effort and commitment you've shown to putting this budget together really means a lot to us. Appreciate it.
Mike, I just have one question. The outside agencies that get funded, like the libraries and the IDA, are not in this?
Yes, they're in the non-departmental.
Okay.
It's alphabetical.
Okay.
If you look, I don't know if they're not page numbered, Larry.
Yes.
It's around $2 million in that area then, without
The title on it says non-departmental on that page. Larry.
I'll find it. Thank you. 62.
Any other questions for Liz?
No, I'll just mention one thing, Larry, that there are 3 agencies that requested funding that are not included on that list, that the Ways and Means held out. We were going to look at where we are with sales tax, which we've done the last 2 years, and also the IDA request would fall into that as well.
Other questions for Liz? Again, thank you, Liz. Patty, Treasurer's Report.
Thank you, Mr. Chairman. I have my report on the balances. Special legislative contingency is $249,168. Contingency is $361,987. Capital data processing is $128,169.66. Capital equipment, highway is $137,213.98. County capital equipment, $239,059.28. Sales tax is on budget at $8,221,729.18. Hospital repayment, they are on target for a balance of $2.6 million. And internal service fund for the month of September had a loss of $77,810. So fund balance is at $893,234. And that's my report. Thank you, Mr. Chairman.
Thank you, Patty. Questions? Dick?
Patty, could you also mention, I think the hospital has prepaid or paid ahead on the pension that's usually due in December?
Right. They have paid
have that
all of
money
their
now.
pension payment for the December 15th payment for their pension.
Thank you.
Yes.
Thank you. Anything else for Patty? Thank you, Patty. For my report, briefly some of the extra outside activities I attended the previous month. Dick and myself attended the Fort Drum Fall event on the 14th. I attended the Domestic Violence Awareness, did a proclamation at Town Hall Theater on the 26th. And Gary Clark and myself attended the inter-county meeting in Plattsburgh on the 27th. And I think Gary will agree that we had a very interesting walking tour into Plattsburgh, and it gave us quite a history of some of the things you don't learn in a history book. We also discussed at our meeting a resolution, and we approved that would support different forms of access and use of the Adirondack Park. I would like to introduce that resolution to our board at our next meeting. It kind of recognizes all the uses that could be done with the state land and brings it to the attention of our local senators and governor. So like I said, I'll do that next meeting. And our final meeting of the inter-county will be November 17th, and it'll be somewhere in Warren County. If anyone's interested, please let us know. That's it for my report. Question, Dick?
Yeah, we have a year to find 5 legislators who are really good with the hammer for the Oktoberfest.
Oh, I think Dick's referring to, I wasn't going to bring this up, but part of the event at Oktoberfest is a Hammerschlagen contest, and yours truly made it right to the finals. And
With a bad wrist in a cast, by the way.
well, I had to take the cast off because I didn't want to let the team down, but we were seconds off winning the event, so maybe next year.
Start practicing.
It's a hammer what?
Hammerschlagen.
They have a 2-foot tall maple log with 5 nails in it, and then 5 smaller logs that you set on around there, and you get 1 hammer. You hit yours and then pass it. And the first team to get all nails in wins.
That's fun.
It was interesting.
Well, what fun we have on that.
And here we thought you were doing important business.
That was earlier. Okay.
We all do our part, don't we, Dick?
Yeah.
Okay, move on. Move on to the Ways and Means report per Rule 7, Terry.
The Ways and Means Committee reports they have examined the claims presented for payment in the total amount of $1,130,838.34 and recommend that they be audited and allowed for the amounts claimed. That's signed by the entire committee.
Moved by Jerry, second by Larry. All in favor, say aye.
Aye.
Opposed? Carried.
First resolution then is to audit and allow the claims in the total of $1,130,838.34.
Moved by Phil, second by Craig. Roll call, please, Terry.
Brennan?
Yes.
Chartrand?
Yes.
Dahlhoff?
Yes.
Halfway?
Yes.
King?
Yes.
Coulter?
Yes.
Marahan?
Yes.
Mosher?
Yes.
Fawcett?
Yes.
Tebow?
Yes.
Fixing date of public hearing on addition to the ATV trail system, JD Realty of Blavel LLC property.
Moved by Craig, second by Larry. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
To set public hearing on the 2017 tentative Lewis County budget for November 15 at 5 p.m.
Moved by Phil, second by Jerry. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
For Public Service Commission to reconsider the Clean Energy Standard Order adopted August 1, 2016, and its effects upon the wood industry in Lewis County.
Moved by Larry, second by Craig. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing agreement between Barbara Lindsay and Lewis County Community Services Department.
Moved by Phil, second by Rocky. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
To transfer funds, Community Services.
Moved by Andrea, second by Rocky. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
To transfer funds, County Clerk.
Moved by Jerry, second by Brian. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
To transfer funds, District Attorney.
Moved by Dick, second by Rocky. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing contract with Lewis Defenders.
Moved by Jerry, second by Craig. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing contract with McCluskey Law Firm to perform conflict defender services.
Moved by Craig, second by Jerry. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
Establishing health insurance premiums effective January 1, 2017.
Moved by Phil, second by Larry. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
To appropriate funds, Transportation Department.
Moved by Jerry, second by Larry. Discussion. Brian?
Liz, with the 2016 Ford half-ton, could the highway go underneath the Enterprise also for
The
that?
half-ton, I think, will.
This half-ton will be underneath that? Because this is for a half-ton and a Kubota tractor. I was just curious if the half-ton could be done through the lease agreement for the highway department too? Or would the type of work that they're doing, would that be too risky as far as damage and stuff?
No, let me
It's a
double
timing
check.
issue, isn't it, Liz? We have to have Enterprise in place before we
Can I say they already purchased this?
Oh, they
This was
Yeah.
something they purchased a couple of months ago.
Oh,
They're
okay.
just asking for the money
Oh,
right
okay.
now.
All right, thank you.
Good point.
Other comments? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Transfer funds, human resources.
Moved by Brian, second by Larry. Discussion? All in favor, say aye. Opposed? Carried.
Authorizing an agreement between human resources and SciTech Business Solutions.
Moved by Jerry, second by Larry. Questions, comments? Brian, would you like to explain this a little, what the purpose?
Sure. Okay, SciTech is a company that we're already working with for our supervisor management training program that we have here. So what the HR committee did is Jim had invited 2 companies in. One was pretty much strictly public sector business solutions and stuff, and SciTech is more private, but they've been doing our training, so we had them both come in. We as a committee felt that SciTech would fit for what we needed. What this is going to be for is to do an evaluation basically of this, of how we compensate our exempt employees, civil service employees, so our non-union employees. So this will give us a baseline. As you know, we have no baseline or any structure set up when we replace department heads or any of these appointed exempt employees. So this, what I wanted this for was just so we have a structure in place, so we have a baseline of where to start people off with salaries and stuff. And also they're going to go through and look at all of our salaries of all of our existing exempt employees, and then kind of measure where they are at. Because right now all we do is we take the information from NISAC, they give us a minimum, an average, and a maximum pay. They don't take into account the per capita, the income for the counties that they're comparing us to. They just give us them figures. So they're going to dig in deeper and give us that information. So, you know, it doesn't mean that anyone's going to get a ton of raises. It doesn't mean that people are going to have pay taken away. It gives us an idea if we're treating our employees fairly. It gives us a baseline to start when we start replacing people as through attrition and stuff. We have a baseline to look at, and they will update this, if I remember right, every 5 years, right, Liz? Isn't that what they said? And SciTech also was considerably less money too, so.
Very good, thank you for that explanation. Any other questions for Brian? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Appropriate funds, information technology.
Moved by Jerry, second by Larry. Discussion? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing an agreement between Public Health and Lewis County Office for the Aging.
Moved by Rocky, second by Andrea. Discussion? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
To transfer funds, Public Health.
Moved by Brian, second by Andrea. Discussion? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Transfer funds, Public Health.
Moved by Phil, second by Rocky. Discussion? All in favor, say aye.
Aye.
Opposed? Carried.
Authorizing execution of a corrected deed.
Moved by Jerry, second by Craig. Discussion? All in favor, say aye.
Aye.
Opposed? Carried.
Authorizing a retainer agreement with Bowich and Coffee LLC for legal and consulting services with respect to environmental conditions on a certain tax delinquent property in the town of West Turin.
Moved by Craig, second by Rocky. Discussion? All in favor, say aye.
Aye.
Opposed? Carried.
Authorizing Recreation, Forestry, and Parks to transfer 1970 Sea King rowboat and trailer to Lewis County Soil and Water Conservation District.
Moved by Larry, second by Jerry. Discussion? I was wondering how the fee of $10 came in.
We just wanted to be technical.
Usually you get $1, but the price went up there.
You know, I'm trying to help Liz with the budget.
Didn't have carried back in 50.
Okay, any other comments? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing addendum to the 2016 agreement with Chamber of Commerce for ATV permit services to have the Chamber provide additional administrative services for the ATV permit system.
Moved by Larry, second by Rocky. Discussion? All in favor, say aye. Opposed? Carried.
Amending compensation plan with reference to Sheriff's Department.
Moved by Brian, second by Dick. Discussion?
Mr. Chairman, if I might, we have been having not very successful recruiting effort, and Under Sheriff called me today and asked, we have not had anybody, either part-time or full-time. We have one nurse who might be interested, but not at the current wage rate. So Jim looked into it and discussed it with Mary Lou today. The current rate is what's listed on the resolution, $23.70 to $25.61. The recommendation from HR is that we authorize one step above the minimum for every 2 years of experience. This would mirror the contractual language for public health and community services healthcare employees. So 10 years of experience would equal 5 additional steps. So I'm asking that the rate be amended in such a way that we have some leeway to see if we have to, because we're required by law to have a jail nurse.
Do you have any estimates on what the salary would end up being? Or?
5 steps would take them
Liz,
away.
do you have a maximum?
35, probably.
Jenny, you know?
2561.
That's the maximum that it is right now.
But 5 steps would take them where?
That is step 7.
So you would start them at the max,
Potentially, yes.
and then they have nowhere to go, or?
At this point, they would have nowhere else to go unless we reallocate it to a higher grade.
Which we could also do.
We could also do that.
Just for comparison purposes, a hospital RN starts at $27.85 and goes up to $35.12. So we're still below that, but we're not getting any takers, and we have to fill this position.
So Jim, if we went to this higher grade, what would the salary rate be for that?
The rate would be, what Jim's suggesting is take the current jail nurse, the rate for the current, in the contract, a jail nurse today would start at $23.70. They would max out at $25.61, and I think what he's suggesting is that we, instead of starting at the contractual rate of $23.70, which would be the first step, we put the minimum at $25.61. Is that accurate, Jim?
Essentially, yes.
What would that do to our budget?
It's
$3
they
an
have,
hour?
the sheriff's budget has money for this.
Okay, it's something that's already in
The
the
difference is not
contingency
going
in the
to
budget.
be, yeah, the difference isn't going to be.
I guess I'm wondering if this is an RN position, right?
Yes.
And an RN starts at the hospital at 27. Why is there differentiation between this RN jail nurse and a hospital RN? Why wouldn't
That I can't tell you. I'm assuming it has to do with, I mean, the hospital, well, I guess you're dealing with the quality of care. I don't know.
Two
It's
different
just what it's
contracts,
been.
2 different wage scales, just two.
Jim, could you just reallocate it to a higher grade starting at,
It's currently at the grade 31. The highest grade we have is grade 34. So there is a little flexibility. We wanted to reallocate it to a completely higher grade.
do you have the salary?
I think we need the numbers to correct this resolution if we so choose.
So what I think you're saying is, Jim, that, okay, this is a grade 31, so what you're suggesting is to bump it up to grade 32, they start at the bottom step level, step 1, and then that way they have their 7 steps to go. Am I understanding what you're suggesting?
That is one of the options, yes.
What's that about?
Yeah,
With it,
don't we still need an amount for that, though, what it could,
what's
what's
that
the-
32 start?
Yeah, what's the start and highest point?
34.
Step 32, the highest, grade 32, step 7 is $26.43 an hour.
What's
So-
step 1?
Step 1 is $24.46. So that would be 1 grade higher.
I guess I'm still back to my question. If the hospital needs RNs and they're offering 27, why would anyone take the jail at 26?
That's what's happening.
That's what's happening.
Exactly. I agree with you.
That's why I think
That's
we
what I'm-
approved a motion here a while back, or a resolution from HR to have a committee take a look at where we're at so that we can correct some of these inefficiencies.
But meanwhile, we gotta come up with
Yeah.
a solution today,
Yep.
so what is it you propose, Liz? Exactly. What would you say, Jim, it's gonna take, or anyone, to get us where we need to be?
We could take it up to the same grade as the public health nurse, which is grade 34.
And that's how much?
That would start at $25.97, that's step 1, and maximum would be $28.06.
Is it your opinion that that's sufficient to recruit a nurse? Does anybody know?
Well, ask Michelle, how hard are you having recruiting nurses up to the hospital?
We're having a very difficult time right now.
That should give you an issue.
But the difference too is the work.
The responsibility, I mean, you look at an ICU nurse versus a jail nurse,
There's no comparison.
There's a lot
World
of
difference.
Yeah.
jail nurse is only handing out meds. They're only doing general exams. Basically, anything above that, the doctor, whoever we have contracted for the doctor, gives her or the person the orders. So, I mean, when she's there during the day, she hands out the meds and all that. She does exams, checks, blood pressures and like that. Other than that, I mean, that's pretty much the scope of their duties down there.
I wouldn't
So
want
that
to
would
say
be-
it's simple or
No,
easy to
no.
do, but on the same hand, I don't think it puts the stress on them that working at the ER would. So you might be able to find someone for a little less than they pay at the hospital, that's all.
Larry?
Well, if we went with the 34, it'd be a little less than the hospital.
Yeah, I wouldn't have any problem
Probably
with
quite a bit more than the 2370.
I'd like to make a motion to amend this to a grade 34, which starts at 25.
$25.97.
$25.97.
I'll second that.
Can go up to 2806.
28.06.
Okay.
Is that motion going to allow that same flexibility that Liz was asking for, to find a wage within that range?
Well, the way I understand it, grade 34 would start at 25.97, but they still have the 7 steps to get to 28.
Correct.
We can start with that.
So we can at least try that offer.
Okay.
Okay, so we've got a motion by Larry to amend, Jerry seconds the motion. Do we have any discussion on the amended motion? Okay, all in favor of amending the main motion, say aye.
Aye.
Opposed? Carried.
Now we need to
Now we need a, is there any further discussion on the amended resolution? Okay, we'll vote on whether we accept the amended resolution. All in favor, say aye.
Aye.
Opposed? Carried.
Transfer funds, Sheriff's Department.
Moved by Dick, second by Brian. Discussion? All in favor, say aye.
Aye.
Opposed? Carried.
To appropriate funds, Social Services.
Moved by Andrea, second by Rocky. Discussion? All in favor, say aye.
Aye.
Opposed? Carried.
Transfer and appropriate funds, Social Services.
Moved by Jerry, second by Andrea. Discussion? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing cooperative agreement between DSS and the Law Department for child support enforcement proceedings.
Moved by Rocky, second by Jerry. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Agreement between DSS and County Law Department for purchase of services, collections, and recoveries.
Moved by Rocky, second by Larry. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
Authorizing cooperative agreement between DSS and Law Department for purchase of services.
Moved by Phil, second by Rocky. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
Amending compensation plan with reference to social services.
Moved by Jerry, second by Andrea. Discussion.
Just for everyone to know, the two sheets on top of our board packet, those are your replacements, all that. Just want to make sure everyone remembers that. So if you have any, if you have any questions, because sometimes they might not be brought up in your meetings.
So
It's good to have those.
is this a change in title then?
These are two of the examiners that Stacy had started changing titles because of the Medicaid billing being taken over by the state. So this is all part of that program that she had started.
To retain position.
Well, they're combining duties. They're almost like they're cross-trained, right, Jenny? They can do 2 or 3 different things
It
with
allows
this
us the
title.
ability to move people around departments,
Right.
having a more generic title.
To retain position is the way it looks.
Any other comments on the resolution? All in favor, say aye.
Aye.
Opposed? Carried.
Authorizing the agreement between DSS and Rubensall, Knudsen and Associates.
Moved by Andrea, second by Rocky. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
Authorizing the agreement between DSS and the Resolution Center of Jefferson and Lewis counties.
Moved by Larry, second by Brian. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Authorizing the agreement between DSS and Volunteer Transportation Center.
Moved by Craig, second by Rocky. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
To appropriate funds, stop DWI.
Moved by Dick, second by Jerry. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
To appropriate funds, bus operations.
Moved by Larry, second by Brian. Discussion. All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
To appropriate funds, Workforce Investment Act.
Moved by Rocky, second by Larry. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
To appropriate funds, Workforce Innovation and Opportunity Act.
Moved by Phil, second by Larry. Discussion. All in favor, say aye.
Aye.
Opposed? Carried.
The two late resolutions, number 462, authorizing the agreement between Frontier Communications and the county for a 911 phone system maintenance services.
Moved by Brian, second by Jerry. Discussion. Jerry, can you explain this? I didn't have time to read it.
Yeah, essentially, we bid out the maintenance and stuff like that. And we had, I don't know, 3 bidders, I believe it was. This one came in the lowest for the length of time we wanted it, and we can use money from the PSAP grant because it's eligible for this. So it's out of the PSAP, it's not on taxpayer dollars.
Very good. Other questions? All in favor of the resolution, say aye.
Aye.
Opposed? Carried.
Amending compensation with reference to Lewis County General Hospital.
Moved by Dick, second by Andrea. Discussion. Dick, what's this one?
Yeah, this is a lot to do with our changing over to consistency of care and patient care. And we've got a clinic resource manager and a corporate compliance officer who will work with these case managers. in the emergency room, they'll work up a discharge plan per CMS proposed guidelines. They will handle DISRIP under care transition, ER to home, non-insured and underinsured population management, and an acronym PAM coaching. Readmission prevention, care coordination, they will provide education, level of care, placement, and evidence-based criteria for the new way we're going to get billed. They will do post-discharge phone calls, medication management, disease management, chronic health conditions, insurance self-pay and resource consultation with the patients, assisted patient case management, and as I don't have on this list, but it will take some of the time that our higher paid people are working at this stuff now and allow them to do more of the higher paid work. The inpatient case manager will admission assessment, plan intervention for care transition, do chronic disease management, high risk for readmission screening and implementation, care of level of care determinations, evidence-based criteria again for where we're going to have to show that we're keeping people healthier. They'll do reports, medication management, clinical reviews, insurance denials and appeals, discharge planning, referrals, and home health coordination. And then the two under clinic case managers, they will do the DISRIP, patient-centered medical home. Also, again, the PAM, and I'll ask in a minute what that is. Disease management of chronic conditions. They'll do behavioral health, palliative care, admissions, readmission prevention, so that we don't get dinged, people coming back too soon. Pre-surgery documentation, reviews of insurance requirements, transition of care, authorizations, and orthopedic pre-admit program.
And
Michelle, what is PAM? I didn't take that down there. Do you know, offhand?
It's some kind of screening tool that we do for districts.
It is, I
don't
just
know
didn't know
the
that.
acronym
Okay.
off the top of my head.
It's a screening
I think
tool.
it's patient activation measure.
Okay.
Well, that explains that.
That explains it.
Any other questions or comments on the resolution?
Michelle, I guess this would be directed to you. I know that it's very important that we do as much as we can to case manage so people do not have readmittance. But it dings us if they're readmitted to our hospital, even though they were released from another hospital, correct? So if they went to St. Joe's, had a procedure, they were released from there and they came back too early, but they came here because they're residents here,
That would ding St. Joe's.
Okay. Okay.
So if they were in our hospital and came back, it would ding us.
Affect us.
And even if they went to St. Joe's from our hospital, it would ding them.
Okay. So there is a way that these people can manage all the patients that would affect us in that manner. Okay, thank you.
Try. I mean, it's
Yeah, I understand.
more and more popular. We talked at our earlier meeting even about having a case manager for our own health insurance for the county folks. So just keeping people healthy.
Thank you.
Other comments on the resolution? All in favor say aye.
Aye.
Opposed? Carried.
That concludes resolutions.
Okay. Other business. We have some proclamations. Terry?
Proclamation for October as National Domestic Violence Awareness Month. Whereas the crime of domestic violence violates an individual's privacy and dignity, security, and humanity due to systematic use of physical, emotional, sexual, psychological, and economic control and or abuse, including abuse to children and the elderly. 1 in 3 women and 1 in 4 men have been victims of some form of physical violence by an intimate partner within their lifetime. The problems of domestic violence are not confined to any group or groups of people, but cut across all economic, racial, and societal barriers and are supported by societal indifference. The impact of domestic violence is wide-ranging, directly affecting individuals and society as a whole here in this community and throughout the U.S. and the world. Lewis County Opportunities, working with the Department of Social Services, the hospital, the Sheriff's Department, and the courts of Lewis County, along with other community agencies, advocates for the needs of victims, and provides a wide array of services to victims and their families. In recognition of the important work done by Lewis County Opportunities, their Victim Services Program, I do hereby proclaim the month of October as National Domestic Violence Awareness Month, and urge all citizens actively participate in activities and programs to work toward improving victim safety and holding perpetrators of domestic abuse accountable for their actions against individual victims and our community as a whole. And I know the chairman had read this at your event earlier in the month. We also have a proclamation to declare November Epilepsy Awareness Month. When a person has 2 or more unprovoked seizures, they are diagnosed with epilepsy. Seizures may be caused by a brain injury, infection, or a family genetic tendency. For 7 out of 10 people with epilepsy, however, the cause is unknown. 3 billion Americans have epilepsy, making it the 4th most common neurological condition in the U.S. Epilepsy is more prevalent than cerebral palsy, MS, Parkinson's disease, and autism combined. Each year, another 150,000 Americans are diagnosed with epilepsy. A national report by the Institute of Medicine states that 1 in 26 Americans will develop epilepsy at some point in their life. Despite all available treatments, 4 out of 10 people have uncontrolled seizures, while many more experience less than optimal seizure control. Every year, 1 in 150 people who have uncontrolled seizures dies from sudden unexpected death in epilepsy. For the U.S., the annual number of deaths is 2,750. In comparison, 2013 sudden death, infant death syndrome caused 1,575 deaths. The Epilepsy Foundations Institute has released a special report to raise public awareness in the epilepsy community and promote steps that can prevent these deaths. Now in its 35th year, the Epilepsy Foundation of Northeastern New York offers programs and services at no charge to an estimated 45,000 afflicted persons and their families living in a 22-county service area in northeastern New York, including over 500 people with epilepsy in Lewis County. The mission is to stop seizures and sudden unexpected death in epilepsy, find a cure, and help people and their families overcome the challenges created by epilepsy through services, education, advocacy, and research. The Foundation provides advocacy, counseling, support groups, and service coordination, as well as education and first aid training in schools, businesses, and to first responders. The Foundation works to ensure that people with epilepsy have the opportunity to live their lives to their fullest potential. Epilepsy Awareness Month each November challenges the general public to better understand this disorder, how to recognize seizures, and provide proper first aid techniques. It also is an opportunity to encourage government at all levels to fully support epilepsy research programs that are seeking new treatment and a cure. Therefore, Michael Taybalt recognizes that November as Epilepsy Awareness Month and encourages the citizens of Lewis County to better understand this disorder and promote epilepsy research programs that seek new treatments and a cure.
Thank you, Terry. Does any member have any other business before we go to executive session? Dick?
Yes, Mike, just as I was leaving the house tonight, I got a call from Dan Solomon, who's the village's liaison representative to us, and he wished to express his regrets not being able to be here tonight. He had a family emergency come up. He didn't tell me what type, but something he had to take care of. But he wanted to express on behalf of the village board their appreciation and thank you for what we did with the tipping fee for the craft project. Additionally, he wanted to, as we've read in the paper, they've approved several resolutions, and the craft project is now moving forward as far as he knew, without a hitch, headed to completion.
Very good. Other business before we go into executive session? Go ahead, Phil.
I wonder if you're gonna call on me. I have a question for Frank Pace. I didn't get very good understanding on that meeting on Thursday, the Fort Drum thing. Could you give us a brief of what that's about?
It's the consultant for Fort Drum Matrix. They're going to be coming here to meet with a group of our department heads to discuss different land use activities that are related to Fort Drum and maybe related to Lewis County in general. It's an informational gathering, basically similar to what we attended several months ago over at the Carthage School in the summer. It's going to be probably a group of either 3 or 5 of Matrix consultants coming and talk to our group. The hospital will be presented there, Sheriff's Department, Highway. Those types of departments will be there to answer these questions. We have about, it may go as long as 4 hours. It may be less than that depending on how quickly we move through the agenda that Matrix has for us.
Okay, thanks.
Will there be a Fort Drum rep in attendance with the contractor?
I don't believe that there will be. I believe it's just going to be their consultant, Matrix.
Answer your question, Phil?
It told me I really didn't need to come to it. It's more, I didn't understand it's more department head type thing, so. Thank you.
Other business? Okay, do we entertain a motion to go into executive session for the purpose of discussion of professional service agreement and we have a specific personnel issue? Motion? Moved by Brian, second by Larry. All in favor say aye.
Aye.
Opposed? We are in executive session. Do we need a recess?
Short one.
Okay, we'll have a 5-minute recess.